Thank you. Joining us from Steiner Ranch Dermatology is Dr. Ken Lane, and he has been on the show many times, and we are talking about melanoma this morning. What is it, maybe how to recognize it, and, do we have some treatments out there for it?
You know, recently they had a big cancer conference in Chicago, and they talked about new treatments for advanced stage melanoma.
Okay.
Unfortunately, melanoma, when caught late, is relatively deadly. We don't have good treatments that prolong survival. But these two new studies have come out that have shown an increase in survival when using these certain new medications.
Okay. All right. So first of all, how do you know that it's melanoma?
So melanoma is cancer of the moles. It's cancer of pigmented lesions usually. So it's a mole that is changing or growing or painful or itchy. Any kind of change in a mole is something that you should be worried about and go see a dermatologist for.
Okay, and aren't you looking for an irregular shape? Isn't that one of the keys?
Exactly. It's ABCDs. A stands for asymmetry, where where one half doesn't look like the other.
Okay.
B stands for border. The border should be regular. If it's jagged or scalloped at all, that's a problem. C stands for color. There should only be a couple of colors in a mole. And D stands for diameter. Usually benign or regular moles are less than about 1/4 of an inch.
What about ones that come up suddenly? I know that I've been in the sun for a lot, I've been a lifeguard and all that. And I remember a few years ago, just one randomly appeared, and the doctor removed it. He didn't want to take any chances. What about things like that?
The vast majority of melanomas occur in brand new moles, which is why it's important to get a mole check and get a mole map done, where you look at all the moles that you already have, because that way when you come in, we can check compared to your old file whether there are any new ones that have come up, and those are the ones that raise particular suspicion.
When you have melanoma, does that transpire pretty quickly in terms of the irregularity and the changes in color? Does it or can it happen over time?
It can be both.
Really?
It can happen very quickly, or it can happen very slowly.
I see. Okay. So just a matter of getting in and getting checked out, making sure you're aware of the moles on your body. Okay, so tell me more about these treatments. What is available if you're diagnosed with melanoma?
So it's really interesting. These new treatments focus on ways to get your own immune system to fight the cancer. The latest treatments in melanoma have focused on vaccines. So vaccines are trying to get your own immune system to fight the melanoma, but they haven't been very successful because, unfortunately, there are checks and balances in your immune system along the way which limit how well vaccines work.
Right.
These new treatments kind of overcome the checks and balances of your immune system and allow your own immune system to fight the cancer. And so they were looking at these melanoma patients with very advanced cancer that were inoperable.
What are we talking, like stage 3, 4?
Exactly, stage 3 or 4 cancers where they actually showed prolonged survival using their own immune system, which means that there are going to be less side effects than with regular chemotherapy.
Right.
And, these are ways that we can treat the cancer that are much more natural in a way.
How does the treatment work? Is it like a vaccine? Is it a topical? What is it?
Well, there are two different ways. One of them was infusing an interleukin, which is a chemical in the body that promotes the immune system.
Oh, gotcha.
And using this certain interleukin, it caused certain cells in your immune system just to expand rapidly, and those fought the cancer. Another way was to have an antibody which was against a certain check in the immune system that didn't allow the body to really fight the cancer. And by decreasing that check, it allowed the immune system to really go after the cancer much better. I
see. Okay. And so are these available in the U.S.?
Well, the studies were done in the U.S. and Canada.
Okay.
These are phase 3 and phase 2 studies, which means they're relatively early on. The phase 3 study, it should be available, that medicine should be available, they're thinking, by the end of the year.
Okay. So they're still in trials, and maybe we'll see it in a few months.
It's very exciting.
Well, thank you, Dr. Lane. We appreciate it.
Thank you.